America and Canada, allies in politics, rivals in sports. We've got a lot of things in common. We both speak English for one, though they're pretty good at French too. We both love Celine Dion and Garth Brooks. There are some differences, however. Baseball, that's our national pastime. Theirs is hockey. They also like the metric system. We still use the king's foot for our measurements. But no subject whatsoever gets more attention when drawing discrepancies between the two North American neighbors, like healthcare. In America, liberals tend to lionize the Canadian system. Conservatives pan it. So what are the facts? First, the histories. The U.S. healthcare system sprung up mostly during the Industrial Revolution. Factories were dangerous, and emerging unions fought to have employers pay for injuries and illnesses workers got on the job. In Canada, this guy, Tommy Douglas, developed their single-payer system in the 1960s. Some polls say he's more popular in Canada than Wayne Gretzky. Canadians pay taxes for their health care, and each province or territory provides medically necessary services with that money. But here's a catch. Each province or territory gets to decide what medically necessary means. There are a lot of different estimates, but Consumers Mutual says the average Canadian pays about $160 per month in taxes for that basic coverage, or about $2,000 a year. Private healthcare still does exist north of the border, but as a supplemental option, and a lot of Canadians do buy that. In the United States, our employer-based system varies wildly. We pay premiums every month, and if we need to actually access healthcare, most of us have to pay hundreds or thousands out of pocket before that coverage ever kicks in. eHealthInsurance.com says the average deductible for individual plans is $4,358, $7,983 for a family plan. Let's say your premium is $200 a month. For a family, you are closing in on $10,000 a year before you see any coverage. And that's just what workers pay. On average, U.S. employers pay more than $13,000 per employee. Okay, consequences of the cost. An article in the American Journal of Public Health shows more than 2/3 of all bankruptcies are because people cannot pay their medical bills. Canada does still have that problem too, but to a much lesser degree. 15% of people 55 and older who file for bankruptcy in Canada do it because of medical costs. And like in Canada, most lifetime caps are prohibited by U.S. plans. But before Obamacare, as an example, if you had cancer, they may have stopped paying for your treatment once you hit $1 million. A big thing people talk about with Canadian healthcare is the wait time. And yes, some estimates say it could take 22 weeks to see a specialist after your primary doctor makes a referral. Even just getting an MRI could take a month. In the U.S., it's between 18 and 22 days to see a specialist. In both countries, healthcare costs are rising, but there are a lot of factors that go into that. Popularity for each system also drastically different. In the United States, a Gallup poll shows our healthcare system has an approval at around 38%. In Canada, surveys regularly show approval for the healthcare system is in the 80s. And a recent Nanos poll showed 60% of Canadians are willing to pay even more in taxes for expanded coverage. There are tons of other aspects we don't have time to look into, like prescription drugs and the arguments some make over quality of care. But these are some of the basic numbers and facts that we could dig up when comparing the United States and Canadian healthcare systems.